Ignorance about the Obama health care law remains very high, reports the LA Slimes. Obama's health care law remains largely a mystery to most Americans 3 years after the president signed it, a new survey showed. Well, they're going to have a rude awakening, all these drones, aren't they, ladies and gentlemen? Today, nearly 6 in 10 Americans say they still don't have enough information to understand how the law will affect them. Ignorance about the law is even higher among Americans who stand to benefit most, with more than two-thirds of the people without health insurance reporting they don't have enough information. Starting in 2014, insurance companies will be prohibited from denying coverage to people with pre-existing medical conditions, and millions of low and moderate-income Americans will qualify for new subsidies from the federal government to help them buy coverage. Don't be fooled by all this crap. Your premiums, the vast majority of you are going to see your premiums go through the roof, continue to go through the roof. You're going to see your employers dropping coverage in many respects, in many places. You're going to see a lot of employees out there. You're going to lose your full-time jobs to part-time jobs. It's a mess. It's an absolute mess. You senior citizens with Medicare Advantage, you're going to see that slowly but surely go away. You're going to see much more difficulty in getting the prescriptions you need. And, of course, you're going to have more difficult time getting into the doctors you need, the primary doctors, the internists, the specialists, and waiting lines for operations. All these things are going to happen. All these things are going to happen, which is exactly why Obama, Biden, and their cabinet are exempt from all this. They're exempt. In addition to that, the federal government's going to be collecting now all kinds of information about your medical care and your medical problems. It's really pathetic. But don't worry, these things are all very popular, you know. Hundreds of billions of dollars in new taxes. It's just awful. It's awful, absolutely awful what a free country has done to itself. Already, we have this from Newsmax. An exhaustive study by 3 congressional committees delivers startling news about the dire effects of Obamacare. Obama's signature legislation could increase health care premiums by over 200% and render insurance coverage unaffordable for millions of Americans. Broadly, the new report declares Obamacare breaks its core promise to make health care coverage affordable. The report, The Price of Obamacare's Broken Promises, was prepared by the House Committee on Energy and Commerce, and so forth. Studies and analyses from the Congressional Budget Office, independent actuaries, state insurance commissioners, health plans, benefit consultants, and others have reached the same conclusion. Obamacare will significantly increase premiums. Some estimates show some Americans facing starting premium increases, startling, of 203%. When Obamacare's most costly requirements go into effect in 2014, listen to this, households earning as little as $46,000 a year will receive no premium assistance, yet will be forced to accept unaffordable premium increases, according to the report. The Affordable Care Act will have an especially harsh impact on young Americans ages 21 to 29. Those with individual coverage will see their health care premium rise an average of 189%. They want to eliminate private individual health care, ladies and gentlemen. That first and foremost. Then they want to put the pinch on and eventually eliminate health care given to you by your employer. So they're really targeting this stuff. The report points to several factors that will result in significantly higher health care costs for Americans. The health care bill mandates that individuals pay the same premiums regardless of future anticipated medical expenses, leading to sharply increased premium costs for those who are under 50. It requires that individuals purchase coverage that includes a range of essential health benefits, quote unquote, including coverage for preventive services, chronic disease management, rehabilitative services, thereby restricting consumers' choice in the design of their own health care plans. For instance, if you're a single male, you're going to have to pay for gynecological coverage. I'm just telling you. The law imposes $165 billion in new taxes and fees on health plans. This is a tax on your private health plan, which is going to be passed on to you through premium increases or your employer. One study cited by the report predicts that Obamacare's health insurance tax will boost premiums more than $7,000 over a decade. This, ladies and gentlemen, is nothing more than a massive tax scheme, a redistribution of wealth scheme, not from the rich to the poor, but from the so-called middle class to the poor. And what young people are going to figure out soon enough is that if they don't pay these extraordinarily high premiums for their policies, rather than purchasing policies that are customized to their needs, they're going to be penalized, that is, taxed. And that money will do them no good. You heard the retired Marine. You heard what he told us, what his fiancée told us. He has to pay a $300 tax, quote unquote. It's a penalty. But John Roberts calls it a tax. For nothing. For nothing. He's not a rich guy. They're not rich. So this is what's coming down the pike. In addition to massive inflation one day, given what the Fed's doing. Anyway.